Hello, my name is David Trimberger. This is Molly Hall. We are going to be doing my peer-to-peer adult We're going to be doing my trauma adult physical assessment peer-to-peer attempt number 3. Let's hit it.
You are dispatched to a 56-year-old male with a laceration to the hand.
Laceration to the hand, okay. Starting off, what is the credentials of my partner?
EMT.
He's an EMT. Okay. Where is my nearest level 1 trauma center?
15 minutes away.
Okay. Where is my nearest hospitals going from level 2 down?
20.
20? Okay. Next, just kind of getting like some demographics of my patient, or demographics of the situation. What time of day is it?
7 p.m.
7 p.m. And then, where am I being dispatched to?
It's a nice urban neighborhood.
Nice urban neighborhood, okay. And then, what's the weather like outside?
Sunny.
Sunny? Okay. And then, you said how old was the patient?
56.
56-year-old male. Cool. And you said he just had a laceration to his hand?
Yes.
Okay. So as we roll up on scene, what's my patient presentation like?
Your patient's standing in the kitchen with a hand wrapped in a towel with controlled bleeding.
Okay. Does my patient look at me whenever I approach them?
Yes.
Okay. Then here we go. BSI, is my scene safe?
Yep.
Okay. So going up to my patient, hey man, my name is David. I'm with whatever EMS. What's going on today?
I was cutting an apple when I sliced my hand.
You were just cutting an apple when you sliced your hand? Did the knife penetrate into your hand, or were you just kind of holding the object and you just sliced your hand?
All of the knives were dirty except the biggest one we had, so I chose to use that and I went to cut and just...
Fancy. Sounds good.
Wouldn't recommend it.
I got you, man. Well, a couple questions I gotta ask you real quick. Do you know where you're at right now?
Yes, my house.
You're at your house? Okay, do you know what day it is?
July 5th.
Alrighty, do you know who the president is?
Donald Trump.
Donald Trump, and then if you had 4 quarters, how much money would you have?
$1.
$1? Okay. So next I'm going to go over, look into his oral cavity. Is his oral cavity clear?
Yep.
Okay. Assess his breathing rate. Is his breathing patterns okay?
Yeah.
Okay. I'm going to check for a carotid pulse. Does he have one present?
Mm-hmm.
Perfect. Okay. So I'm also going to kind of do a quick little overview of my patient, see if I notice any other deformities, any other obvious deformities other than just the hand. Do I notice anything?
No.
Okay. Alrighty, my man. Well, are you wanting to go to the hospital, or?
Yeah.
Yeah, what hospital do you want to go to?
Edmond.
Edmond?
Integris.
Edmond Integris? Okay. Well, do you think you'd be able to walk to the stretcher and we can take you to our ambulance?
I guess.
Okay, sounds good. So as we get into the back of the ambulance, I'm going to go ahead and do kind of 3 things at the same time. I'm going to instruct my partner to go ahead and connect my patient to the monitor. So I'm going to be looking for a heart rate, respiratory rate, SpO2, blood glucose, and a blood pressure. And then I'm also going to be doing a sample history and a rapid head-to-toe. So starting from the top with his vital signs, what is his heart rate?
78.
78. What's his respiratory rate?
16.
What's his blood pressure?
120/80.
120/80. And then what is his respiratory rate?
97. Oh, sorry. 16.
16. What's his SpO2?
97.
Okay. What's his blood glucose?
80.
80. Okay. And then I'm also going to put him on a 4-lead. What does his 4-lead show?
Normal sinus.
Sounds good. And then next would be my sample history. So just kind of starting from the top. Hey, man, do you have any allergies to anything?
Nope.
You feel any pain anywhere other than just your hand?
No.
Okay. Do you take any medications? And then, do you have any past medical history I need to know about?
No.
When's the last time you ate anything?
Just ate dinner.
Just ate dinner? Okay, and you said that you were just kind of cutting up some food, and then whenever you cut your hand?
Mm-hmm.
Gotcha. Alrighty, so as I was asking all those questions, I would also be doing my rapid trauma assessment. So starting from the top, so with the top of his head, assessing for any signs of DCAT BTLS. Do I notice anything with it on his scalp?
Remarkable.
Okay, moving down to his face, is his nose in line?
Yeah.
Okay. Does he have a pearlo-pupillary reaction?
Mm-hmm.
Okay. Going to his ears. Does he have any drainage or battle signs behind the ears?
Nope.
Okay. Is his oral cavity intact?
Yep.
Okay. Next, I'll be going down to his throat. Does he have any signs of JVD or tracheal deviation?
No.
Okay. Assessing the chest. Is his sternum in line?
Yeah.
Okay. Is his rib cage intact?
Mm-hmm.
Okay. Going to be assessing equal and bilateral lung sounds in all 4 quadrants. Is that present?
Yep.
Okay. Going to be palpating his stomach, all 4 quadrants. Normal. Okay. Is his pelvis stable?
Yep.
Okay. Then I'm also going to be checking for CMS in all 4 extremities, and as well as decap BTLS in all 4 extremities.
Yep.
Okay. So what hand did he have the laceration on?
Right hand.
Right hand. How big of a laceration was it?
3 inches.
3 inches? Okay. And you said it was 3 inches on the right hand?
Mm-hmm.
Okay. So now that I have all of that information, before I call report to the hospital, I'm going to try and wrap the extremity. So I'm going to go ahead, have my partner stabilize the hand. I'm going to stabilize and wrap the hand and trying to make sure that the bleeding is controlled. And then I'm also going to ask my patient, hey man, do you, what's your pain level that you're feeling right now on a scale of 1 to 10, 1 being no pain at all, 10 being worst pain you've ever felt? How would you rate your pain?
4.
About a 4? Okay. So then after I have that stabilized, I'll go ahead and I will call report to the hospital. Give report to the hospital, then we'll drive to Integris Edmond. Give report at the patient bedside, before I would transfer care, I would be monitoring my patient every 5 minutes while en route to the hospital. Was there any change in patient condition en route to the hospital?
Nope.
Okay. Then as we would get to the hospital, I would go ahead and transfer care to Integris nursing staff and give report at the patient bedside. Thank you.